listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.
Thank you for listening to Community Forum. My name is Johnny Chandler. I'm the owner of KCCC 930 AM and the host of Community Forum. With me today for the second time is going to be Jose Gurrola, the Chief Operating Officer of the Artesia General Hospital. Did I get your last name right?
That's correct. Gurrola, like Corolla. Like
okay,
Gurrola.
Okay, good. I'm never going to forget that now, for sure. That works. I actually own a little Corolla, so that's helpful. So this is the second time. But the first time we had you on was quite a while ago. Right. How long do we think it is?
I think it was a couple of years ago.
Yeah, a couple of years probably. And then this is a perfect segue to introduce Kush, right? Kush.
Hey, Johnny. How's it going?
Doing well. Tell us your last name.
My last name's Ghadial.
Ghadial, okay. And what's your title here?
Director of Public Relations.
Okay, excellent. So, and it was been about 2 years since you were on with us last time as well.
Yes, about that long.
All right, and then just a little bit of history. Kush also used to work for Southeast New Mexico College as well.
I did. That's actually when I first moved to Carlsbad, so that was my introduction.
Right, and you were the one that created the first logo for our independence, right?
Correct, yes.
Right, and I did not know that until I was at a Board of Trustees meeting, and they kind of gave you a standing ovation and an applause for putting that together. Yeah, that's a good look. We've since updated a little bit, but I'm actually wearing a shirt with the logo on it. I think all we really did was get rid of the 1950 and then move like the little Adobe housing symbol thing over to the top of the N a little bit. So the foundations of your logo are still there, right? Great stuff. And you're beloved on campus and in the community. So whatever you did while you were there obviously worked.
Well, thank you. It's good to hear that several years later.
Yes, you are still like very much. I'm not just blowing smoke, even though I might a little bit, right? But that's not the point of this today. So, Jose, is all right if I just reference you as Jose for the rest of the?
That'd be great.
Okay, so Jose, there's quite a few things we want to talk about. We got a limited amount of time, but what I wanted to say is I reached out to Kush and Artesia General Hospital when I was on LinkedIn, and I noticed. I'm just going to start from the beginning. I think it's like there's a lot of great things we're going to talk about, but I felt like this is what really stood out to me. I think we're still facing a nursing shortage in our country.
Right.
And so there was an advertisement on LinkedIn, just a post really. I'm not sure it was an advertisement, but I guess call it an advertisement that you guys are offering $30,000 bonuses for new nurses.
Right. You kind of look around the nation and, nurse shortages, that nursing workforce is, it's apparent, right? And it's something that, has a unique challenge here for us in trying to find, nurses, get them here to the area. But one of the incentives that we're throwing out there is about a $30,000 sign-on bonus for nurses, in addition to some other incentives that we're also offering, up to like a relocation assistance, even special housing.
Right.
So it's just kind of thinking outside the box, trying to get nurses here to this underserved area.
Yeah. So I'm very interested in that because I feel like we've been hearing for years and years, maybe I could argue even a decade, right, that there's been a nursing shortage, right, that we are short nurses nationwide, right? I mean, I'm not sure the COVID helped nurses really feel empowered by the job for a little while as well. But so the idea is could you explain to me a little bit as to why we still have a nursing shortage in general, considering that there's so much incentives, there's so much talk about it, and there has been for a long time. So how is this something that our country is still facing?
Sure. And it's very broad, the answer to that question. There's several factors that you got to kind of consider, especially when you look at rural areas like ours, where sometimes technology, right, is slim to none. And, when you're looking at that new graduating nurse that's coming out of school who's maybe training on the latest and greatest technology, right? So going to rural areas is sometimes difficult, and that technology is just not there. The other thing is, amenities too in rural area versus, like our urban areas that offer, the shopping. They offer, a more commercialized type daily living activities for that nurse. So there's a lot of attraction outside of just the care. Now, when you start looking at care here in the rural area, it is a little bit more complex, a little bit more difficult. So I think some of the new graduating nurses or nurses just kind of looking into the area I see that sometimes there it is a little bit again more challenging for them in the care. They might be acting as a med surge, ER nurse, and an ICU nurse all in
all at the same time.
Yeah, all at the same time,
right?
Because of the population that we serve, the patients, they're a little bit more complex. There's a higher chronicity and acuity with them.
Right. So I was asking Kush before we started interviewing, general question. I was like, and Kush, you can answer this, or Jose, you can as well. His idea is like, on average, annually, how many patients does Artesia General Hospital see?
Wow, annually, gosh, let me see. The last statistics I had, gosh, this is I'm looking at to try to quantify it all together. Well, I could tell you, gosh, in the ER, and what we're seeing is average we're serving about 1,200 patients a day there. On our med surge unit, we can average about 8 to 10 patients a day there. So that's just, patients that are in our inpatients, right?
Right.
But you look at our outpatients where we're upwards to about 5,500 outpatient visits per month. So, gosh, I'd have to get out my calculator and run those.
Kush actually has the number. Yeah, I was kind of testing you guys, but Kush has the number.
I think overall we see what we call patient encounters roughly between 110, 120,000 over the course of the entire
year. Right. And that makes sense because every time somebody walks through the door, it's a patient encounter, right? So you don't just count one patient if they come in 5-6 times a year or 4 times a year or whatever. It's like every time they walk in the door, right? Every time they walk in the door, they probably need a nurse, right? Like every single time.
Correct.
And then obviously the front staff assistants and all of that nature as well. So
absolutely.
So tell me a little bit before we move on about what it means. What do you have to do to qualify for a $30,000 nursing bonus?
Well, actually, new grads, you can be a new graduating nurse right out of school. We just had a graduating class here in May. In fact, we hired two new nurses. You also experienced nurses. You're talking to, the 0, 5, 10, 15 year will qualify you here. Of course, having a nursing license here in New Mexico, that's
one of the requirements.
Requirements.
I think that makes sense.
But overall, just having that experience and, the in-med surge, ICU, the ER, those areas that we're currently recruiting for. But I think most importantly, what we look for, too, is just the willingness, the character and, that drive, that motivation to take care of the patients that we serve on a daily.
How many nurses would you say? And answer whatever you're willing to answer or not, right? But I don't think this is a dangerous question. How many nurses, pardon me, are you short?
Oh, I don't have that number in front of me right now, but I can tell you we've got open positions, in pretty much all of the areas of need. So we're looking at our med surge area, our ER.
So if you had 10 nurses or 10 potential licensed nurses walk in the door, would you be able to hire all 10?
Yeah. You know what? Potentially we could. Yeah. I'm not going to say no.
Okay. All right. And then we know the amenities, right? I've lived in Eddy County now for about 5 years, and I've eaten at every restaurant multiple times, right? Like all of them, a lot. But this is the first time I ever ate at the Green Chili Cafe. Right. And so thank you guys very much for buying me lunch. I really appreciate that.
Our pleasure.
And it was steak. It was amazing. It was incredible. I was like,
yeah, our Green Chili Cafe, it's really kind of a unique jewel is what I call it. It's it's not your average hospital cafeteria.
Yeah.
Right. This is an actual restaurant, that is embedded in our hospital that serves patients, that serves the community. That offers great meals. We've got
the prices are pretty good too.
Great.
Yeah,
prices are great. I challenge anybody, the community, to come out here and to take a look at our menu and price that to other commercial areas here in town. But you'll find that it's a really great deal. But our quality of food, we've got 2 great chefs here, great experienced chefs who've worked in every single capacity here that offer, unique meals. They just, their attention to the details of the food. I mean, you can really taste it.
No, that steak was really good. I was not anticipating a steak for lunch. I did think, Kush, that when I came here for lunch that I'd have a green chili cheeseburger, considering it was the Green Chili Cafe.
We do also have the green chili cheeseburger. It's one of our standouts. But hey, man, it was steak today.
I wasn't going to turn down the sirloin. I was like, there's just no way that was going to happen. Another thing, I guess it was literally, so we pre-record this, right? This will air, this airs a couple weeks after we recorded it. But on the day of the recording, the morning of this recording, there was an announcement that Artesia General Hospital has a deal with Texas Tech.
Absolutely.
Right. Tell us what that deal is.
This is a huge milestone for Artesia General Hospital, really for the communities here. You know, our citizens of Artesia, Carlsbad, Roswell, all our surrounding areas. We're about 1 in 34 within the nation, or here within the area, to have a Texas Tech family residency program here established. What that means is we've got physicians. They're actual physicians who are completing their training. So they're second and third year physician residents who've gone through all their the 4-year MD program. They've done their residency. Now they're picking a specialty. Right, they're going through specialties, whether that's family surgery, pain management, behavioral health. But they're specializing. So. But with that, the third years are they're all family medicine resident docs who can prescribe, who can treat, who can identify diseases and conditions and fix this up. So in all, for the community, that helps to bridge some of these care gaps that we're seeing in underserved areas where it's hard to find a primary care doctor, right? Or it's just hard to get into any kind of doctor for an appointment, to whether that's acute or chronic. But we've got now these family residents who are going to be with us for a while here with our partnership with Texas Tech, and we look forward to it. I mean, this means a lot to us, not just in our partnership in this unique way, but just it's really for the citizens, the care here, that it's just going to close some of those gaps, like I said, and hopefully we'll start looking at the outcomes of the patients in there. That we start healthier community, right? Population health,
right?
That we start getting a little bit more resources out there for them.
And they're going to need nurses, right?
They're going to need nurses. Oh yeah,
just to bring that full circle. So is this like this residency program, this family medicine residency program? Is this like a rotating thing? Is there a end date on this, or do you get you're going to get one that's in the later years where they're choosing their specialty for 2 years, and then you're going to get another one? Like you just kind of rotate them in and out for a while, or how's that going to work?
Yeah, we sure do. So officially, our program kicks off here in July. July 1st. So we're getting two physician residents, a second year and a third year. So it's going to be rotating. The second year will be with us for about 2 years, and then the third year for about a year there, and then they'll rotate. Then we'll get a new physician here. It gives us an opportunity as well to hey, is this the area they get to live here in the area? They're part of our community, and hey, maybe they like it here and they stick around and they stay with us, and that'd be an ultimate goal of ours. But they're gonna be with us. You're gonna see. Different physicians there, at least 2 docs that we'll have here in our program.
Right now, so the medical center in Texas Tech, that is the closest level 1 trauma center that we have here?
Level 1, that we utilize. I know around us, there's El Paso, right? There's also Las Cruces, El Paso, Albuquerque, Lubbock,
yeah, right. That's it. And so, is Lubbock Medical Center connected to Texas Tech, or does Texas Tech have their own medical center or their own university medical center?
It's connected, but it's looking at Midland, Odessa's the family residency program.
Oh, okay, all right. I've been to Midland a couple of times since I moved down here. I actually have it's total sidetrack. They have some great antique stores down in Midland. If you guys ever go antiquing, there's a couple that are worth checking out.
That's interesting. That's good to
Yeah,
know.
no, I bought some really cool stuff for my wife. I went there for some Permian Basin Pipeliners Association meeting, which is completely off base from a hospital system, unless maybe you'll see some patients that are working in pipelining industry. But I was quite surprised. I was spending more money than I planned on it, just driving to Midland and back in one day. So there's a lot of great services you guys have, and we'll get into what the general services are here in a minute. But then there's also another announcement. I guess probably we're going to break the news on this radio program. You guys are working on a mobile clinic?
We sure are. We're expected to receive our first mobile clinic ever here, hopefully late this fall, here at our hospital. It's going to come capable with 2 exam rooms here.
Okay. So it's going to be like on a semi-truck trailer, or is it like a big van or a big bus?
Yeah, it's a big bus. This van, and it was what was this? The size of it was 37 feet.
37 footer, like a tour bus almost.
Yeah,
huh?
this thing is going to be big, So we're actually making some accommodation arrangements to actually build a space for that and for our transportation fleet, but it's what it's going to come with again is giving us the ability to expand our services to actually travel to those communities, those underserved communities that don't have specialists or physicians. So it's going to be connected to our rural health clinic, our Memorial Family Practice. So I look forward to seeing our primary care guys, some of those on there, as well as some specialists that, to rotate through that bus.
Now, is that limited to Eddy County, right? Like, so Artesia General Hospital, I mean, I'm sure you guys have a designated coverage area, I suppose, right? And so is that mobile unit going to be limited to Eddy County? Or are you allowed to jump into Chavez County? Or like, how does that, or can you go to cross state lines of Texas and Pecos or something?
We got to stay within our within New Mexico, let's say that,
okay,
due to our insurance payers and
right.
They want to keep us here, and but that again, that's not to say that we can't explore outside further than that, but looking internally here within the area, our coverage area, so we can expand. We have the opportunity to go within about 100-mile, 150, 200-mile radius. And it's really just a touch base on those areas, those underserved areas, that we just need, that they need a care. They need.
Yeah, I'm thinking about like Hope and Loving and Queen and stuff of that nature, right?
Absolutely.
So they're Eddy County communities where you'd think we don't have very amenities in Artesia or Carlsbad, right? I mean, like you've driven through Hope, right? I think they have a good water system.
Yep. So communities will be able to touch there, drive to them. Businesses as well. There's definitely businesses out there, whether they're oil and gas or industry, farming, or anything out there in those small communities, that even schools that just need a physician, support.
I'm thinking about like the man camps, if you will, right? Or you got these pretty obscure remote camps where these guys are working 14 on, maybe 14 on, 14 off, if not more than that. And when are they going to have the time or the energy to go and get their annual physical or any of the basic needs that guys are so apprehensive to do in the beginning anyways? You know what I mean? Like, it's like, I don't really want to do that. Well, don't worry. All you got to do is walk outside.
That's
right?
the
We'll take
idea.
care of you.
Yeah,
right.
You're spot on.
Right. So, as I was getting a tour of the facility, first time ever in the hospital, thankfully, well, thank God for that, right? That I'm really not in a hospital all that much, or I haven't had to at this point in my life. He didn't show me the MRI machine, Kush. I didn't actually get to see it, but I did pass the door that was there, right? But you were bragging about the MRI machine.
It is the latest, greatest, state-of-the-art MRI at the moment. It's a 1.5T, which is just about as advanced as you can get. People, when they see the imaging, are just really, really amazed by the quality of it. I've had the opportunity to get some imaging done on it, and it's like, whoa, I didn't realize that was, how clear imaging could look just based on previous experiences, things like that. When it was installed, it was one of 6 in the nation, and I believe we were the second hospital to have one in that setting as well. So, if you're looking for imaging, come on up. Jamie, our MRI technician, also does a really good job with implants. Based on your implants, sometimes you have to be very careful how you do that imaging. And a lot of other facilities in the area don't really do that. We do. So that's another thing to consider as well when it comes to that machine.
So I know that neither of you are doctors, right?
No.
Okay, so I might ask a question that would be best for somebody else, but maybe you can answer as best you can. What's the ultimate point of an MRI, right? Like, I mean, there's all these medical procedures. There's a lot of stuff you can do, and I know nothing about hospitals and hospital equipment, right? So that's where I come from, a place of curiosity, if not ignorance, right? But the idea is what's the point of the MRI machine?
Yep. To identify pathology, you gotta it's gotta look what you're identify what you're searching for, what the physician's probably searching for, right? And using this enhanced imaging and to guide them and what how big, how much, where is this also growing into? What's the surrounding tissues, organs that this impacts?
So we're kind of talk about like cancer and tumors and stuff like that mostly.
Yep. So it's just identifying that pathology, those diseases or those conditions that the physician needs to search for to make a decision in his treatment. And why this one is important. This 1 in 5, 1 in 6 in the nation that we have. It's that enhanced image quality. It also has some AI capabilities, some adaptive learning, but as you put this thing in motion, it really lessens the time it identifies quickly where that pathology exists. Take, for instance, strokes. Right? Some 1.5 Ts out there can take anywhere from 15 to 20 minutes to identify a stroke, but having this type of technology, it'll take a minute, if even that, to identify.
And time matters when it comes to strokes.
Time matters. So identifying that is quickly means, hey, we can get this patient to that next level of care, which leads to better outcomes. And
so, Kush, you were also mentioning that the turnaround time to getting an appointment for the MRI machine is pretty good.
It is. I don't want to give you an exact time because the second I do that, somebody's going to be like, well, I didn't get that. But typically within, 2 to 3 days, we can get you in, whether here or our facility in Carlsbad as well. So I recommend calling, and if you don't know the specific number, call 575-748-3333. That's the hospital main line. We can get you connected and taken care of.
Pretty quickly. So we're going to get into the general services here towards the end of the program, which is actually not too far away now. And then also we're going to let you guys talk about the locations that you have around Eddy County. I know you have 2 in Carlsbad, so we'll get into that as well here in a little bit. And they are very beautiful buildings in Carlsbad, by the way. I reside in Carlsbad, so I've seen them. They're attractive facilities. Not every new building that's built is attractive. I'm not a fan of a general steel building on a main road or something, and you guys definitely have not done that. But I did want to ask again about, you guys mentioned something about it when we were sitting down. You're like, well, we should talk about the Da Vinci, right? And what's the first thing that popped in my head?
A painter, right?
Yeah, no. Well, painter, or even more so, Tom Hanks.
Tom Hanks, yeah.
Right, for the Da Vinci Code. And so, a Da Vinci, what is a Da Vinci then? Because obviously you can talk about the painter, you can talk about the Da Vinci Code with Tom Hanks. Those are kind of some of the popular culture references, right? Even though Da Vinci is by no means a popular culture thing, right? The original painter isn't any longer. I'd like to think of the idea that was considered modern art at one point in history.
It's an interesting segue because the machine itself is just about as modern as you can get in assistive robotic surgery. It's a brand new system. It'll be here in August. We're really, really excited about it. And the idea behind it is it's minimally invasive surgery. The surgeon's controlling with great precision this piece of robotic equipment that allows you to make smaller incisions. It's more precise surgery, better healing times, faster healing times, better overall outcomes typically as well. So it's just another way that Artesia General is kind of giving back to the community and the area by bringing this here. And, talking about nurses, talking about bringing in doctors, these are the kinds of things that, doctors and nurses want to see in addition to just patients getting the latest, greatest care as well. So this is all part of a long-term plan.
I'm just curious, and you guys may not know the answer to this, but I'm curious how a Da Vinci surgery machine or a machine allows you to have smaller incisions, right, when it comes to surgery than just a doctor using their hands. Like, how is that something that's possible?
The 3D image quality that this system has, but it allows you to actually increase the size. It magnifies the screen the intensity there, so that the physician, the surgeon there, can actually really get into detail and really control that incision with the smallest, less invasive type of scarring.
So the doctor's like looking at a screen almost the entire time. You're not really looking at the patient as much.
Do you recall? This will kind of show how my age here, but if you remember what was it? The game that we used to play with the Operation,
right?
And you got down to that wishbone, right, or that what was it? The thyroid area where you're getting in there and it's beeping, and it's hard to kind of see that, right?
Right.
Well, if you imagine utilizing this robotic machine, I mean, it blows up it magnifies that image there where it's like picking up a pen with your hand.
Oh, okay.
All right. It's easy, it's simple. I say that for myself, but looking at
for somebody that's never actually done it.
Yeah, but we actually had an opportunity to play around and demo this robot ourselves, where we got in there and kind of play with it.
You weren't demoing on patients, were you?
Not on patients, yeah. And it was really interesting, though. It is a technique, but just the type of technology to have that here within a hospital, to have that as an extension of the surgeon, is truly remarkable. Again, as Kush had mentioned, having faster recovery, less scarring, that image quality, really, we're looking at improving the true outcomes of patients here.
Right. So how special is that to have a dementia machine in Eddy County? Is there one here?
It's becoming a standard out there. As Kush touched base on this, it's so much of a standard now that you have to have one of these Vinci robotic machines in a hospital. As for our surgeons coming out of school are training.
Yeah,
on
that's
these,
what they're training on.
Right. And so, in order to keep up with those times, like our technology, we have to have one of these. So. I believe there's a few hospitals in the area that have this type of technology.
So it should just become common, right? Like when you go to a hospital and you need surgery, the dementia machine is what you're gonna get, right? Eventually.
I think still, looking at always going past the assisted robotic surgery is, the surgeon who's operating behind you. So they. The right surgeon, the character there. We've got a great team here, great surgeons here, great feedback. So check us out.
I will. So that's a natural segue. Kush, you've done a couple great natural segues this half hour already, but that's a natural segue to talk about the Artesia General Hospital general services, right? Like I already did it. Too many generals in one sentence, but I told you I was going to do that at the beginning of the episode anyways, right? So. You guys do offer a lot here, so let's talk a little bit about how beneficial it is for Eddy County to have a nonprofit hospital serving them. Right? What can you tell me about that? I'm like maybe get a little closer to the idea of like, you work for a nonprofit hospital that serves the community, right? So that makes people better, that is there for families in their biggest time of needs, right? So what does that mean to you, being able to be in the position that you are at a hospital such as this?
Under a nonprofit, we truly are servants. We're servants to the community. The community gets to have a large say in how we move forward and what new service lines we adopt here within our hospital. For example, we just finished about a year ago, or about a little over a year, our community health needs assessment. And as a nonprofit, we're required by the IRS to every 3 years to go out to our community and ask our community, hey, here's what we do well, but tell us what we could do better on. What is it that the community that you feel we should look at adopting, whether it's a new service line, a new physician, or there's something that we need to focus on. So in that, community health needs assessments help guide us, helps the nonprofit guide us into moving forward. So it gives that say to us as the hospital administrators or in the hospital leadership to then say, you know what, let's get a Da Vinci machine, or we need an endocrinologist, we need a general surgeon, we need to look at our strategic plan and our model around the community. So decisions ultimately are made on the citizens of the community
by the citizens of the
by
community.
the citizens versus,
and you obviously have a board that you report to and all things of that nature as well, right?
A hospital district, which they're great as well in supporting our, where we're moving. So I think that's the biggest plus side of being a nonprofit.
Right. Let's chat about the locations that you have in Eddy County, Kush or Jose, either one of you. Like, what I know there's a couple locations in Carlsbad. Let's talk about where those are at.
So we have a primary care clinic in Carlsbad on Hagerman. It's right behind where the school admin office is. So if you kind of went behind there, you should see it. In addition, we also have imaging in Carlsbad. You can get an MRI, X-ray, you can get an ultrasound. So we have that. We have bone and joint. We've also recently brought our general surgeons down to the primary care clinic as well. So while you do get surgery up here in Carlsbad, your pre- and post-care visits can be taken care of in Carlsbad. We also have Liz Madison, who works with cardiology. So lots of different options. We have behavioral health as well. That's an important one down there. So lots of different things.
Right. So you actually have the surgery here in Artesia, but then you really only taken one trip
Correct.
to Artesia necessarily, so you can get all your inpatient or all the before and after stuff. Since
exactly.
I don't know the terminology, I've never worked in a hospital system, right? So you get all the before and after stuff, which is maybe you should officially call it that, Jose, from now on. Before and after
Before
stuff.
and after stuff. There we go.
Stuff being
you
the
go.
key.
Yeah,
Stuff being the key word, right?
Yeah.
So, but you can do that down in Carlsbad. So that's part of your nonprofit mission, I suppose, is to help grow services in your service area.
Right. And, to segue on that, we have a great transportation service. We've got a transportation van that offers, a transportation to our patients from Carlsbad to Artesia as well. So
Right, I saw that. I saw a sign for that hanging, right, is the idea that Monday through Friday, 7 a.m. to 5 p.m. with an appointment, right? So not emergency services. We're not gonna, that's what ambulances are for, right? So you guys you'll be able to pick you up, get you to an appointment on time, and you don't have to worry about transportation if you just go ahead and do that. So where's the best place, Kush, for people to do that? Is that going to be on, just go on the website?
Just go on the website or call that main line number, 748-3333. 575 is the area code.
Sure, right.
Our operators are great. They will get you connected to whatever service you need. That's kind of the main number I remember, considering all the different clinics and everything.
Yeah, but if there's a main one, that's the one that we want to get out to everybody.
Call. Yes,
right. I have one last question left, and I'd asked Kush this earlier, Jose. So I'm not no more gotcha stuff, right? I did that with the numbers, but so the idea is like there's a lot of services and there's a lot that you guys are doing, right? And nonprofit hospital. So I'm just curious how we afford all of this. How does Artesia General Hospital afford to bring in a Vinci surgery machine, afford a mobile clinic, right? Offer $30,000 nursing bonuses, right? Connect with Texas Tech for a family medical residency program. So as you can tell, I'm roping in all of the conversation into this last question as well. So how can you afford to do that? Like what funds all these programs? Besides obviously insurance and stuff is used, but like how do you get the upfront cost to provide all these services and get this equipment for everyone?
Well, we still, as a nonprofit, that doesn't mean we don't care about our profit margin. We absolutely do. No margin, no mission. Right?
Okay, fair.
But kind of looking at our service lines and what we can do best to kind of optimize those services and thinking about the patients and the outcomes primarily, but. There's a lot of funding out there that with the new Rural Health Transformation Program that offers opportunities for hospitals like ours and others to tap into, whether that's, for recruitment, technology, added new service lines, recruitment physicians. So look at those grant opportunities, look at those funding opportunities. They're out there, and they can help support some of these initiatives that we've got going. But overall, we got to be good stewards of our resources here internally of what we've got, and making sure that when we make plans to purchase new Da Vinci's or new programs, that we've got that sustainability plan. How we're going to utilize it, how we're going to adapt to it, and move forward. So we're very blessed, I think, in the area to be where we're at. and this is again through the support of our great stakeholders, which are our community and our hospital district. We're very blessed. Oil and gas, a great area to be in Artesia, and where we see other hospitals really kind of struggling across the board. You hear about closures, even in large cities, but mainly the rural areas, they're shutting down where they contracting services, or they don't have enough funding to operate. We stay fairly blessed, but it has to do with being innovative, sometimes taking those risks that others are scared to take those challenges on. And, we have to think we have to start thinking in the best interests of our patients, our communities, versus, within, hey, what do I need for, versus
right.
what, the community needs. So, it's a mentality. I think it's a mentality, state that we've got to change.
All right. So we're pretty much out of time. I've gone a couple minutes over, Kush, but for this very last moment, I want you go ahead and give the phone number again for people to go ahead and reach out if they need some services.
It's area code 575-748-3333. And you can always go online to our website. That's artesiageneral.com.
All right. Kush, Jose, thank you all very much.
I agree. Thank you.
You're listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.